fully dry. Standard precaution is used for basic care of most patients. It would require hand hygiene, gloves if necessary, mask, um, face shields, respiratory hygiene, safe injection practice, and it's kind of what it is. Contact precaution refers to the care of handling contaminated blood fluids or body fluids. Indirect care refers to transfer of infection organisms through contamination, intermediate objects such as contaminated instruments. Contact precautions equipment is usually gloves and gowns, and some infections you would use it would be MRSA, C. diff, herpes. For droplet precautions, it's used for any infection that's transmitted by large droplets expelled into the air. Travels about 3 to 6 feet. The precaution requires a surgical mask within 3 feet of the client, hand hygienes. Mask should be applied prior to entering the room. Example of droplet precaution would be used for the influenza virus. Airborne precautions is used for disease transmitted by smaller droplets. Droplets remain longer in the airborne for longer periods of time. Isolation would require a negative airflow room, and this would require an N95 respirator. Respirator should be applied prior to entering the room, and the disease that could be used on would be tuberculosis. So first thing is the sharps container. Any object that's sharp or such as needles should go directly into the sharps container. Any bodily fluids or basically napkins, anything that's come out of the patient should go into a biohazard bag to be disposed of. And any linens that fall on the floor or haven't contact with the floor should be placed away into a special leak-proof container. And do not shake the linens. And any bodily fluid should be considered contagious. So aseptic technique is used when you're treating an open wound, burns, or anything that we need to use to avoid infection. It would require a hair cover, a mask, sterile gloves, and a sterile gown. And basically the goal is to avoid any contaminations. So any breaking of sterile field or puncture to the product can cause and be a contamination. Alright, I'm going to set up a sterile field. I wasn't given a sterile field package, so we're just going to simulate this. We do the best we can. So first we do 5 furnace, then we would do the sides, and then we would do the one closest to us. And we grab this one through here, like this, grab it on this side, then we would do like that. Alright. And pour the sterile solution.